But that does not add up well, and neither does this. We spend more on healthcare than any other country in the golf club, especially out of our own private little pockets.
Oh, our quasi-privatized healthcare system doesn't just subsist off of our private little pockets. Many people from countries with socialized healthcare systems, like Canada, bring their private little pockets down here for the privilege of receiving treatment under our system. Now, why on earth would they do that?
Okay, there is no evidence that a significant number of Canadians come to the United States for healthcare. There is almost no evidence of that. So this is a Vox article from Julia Belluz, who's a research journalism fellow at MIT. This idea is often floated by critics of universal healthcare on both sides of the border, but the best available research shows that it's simply not true. Canadians are not fleeing en masse to the US seeking medical care. The most comprehensive look at the issue, published in Health Affairs in 2002, entitled Phantoms in the Snow, researchers gathered data on Canadians' use of the healthcare system by surveying US border facilities and America's top rated hospitals about how often they see Canadians seeking healthcare. They found that this happened rarely. They also tracked Canadians' behavior by examining data from the National Population Health Survey, where 18,000 Canadians were asked if they sought medical treatment in the US. Only 90 of those 18,000 had received care in the United States, only 20 of them had done so electively. So the health affairs researchers found no evidence for the idea that Canadians are fleeing their health system and concluded that it's a persistent myth. One salient reason they offer: even if Canadians wanted to escape their system, most probably could not afford US medical care. Prices for US healthcare services are extraordinarily high compared with those in all other countries, and this financial barrier is magnified by the extraordinary strength of the US dollar. Private insurance for elective surgeries being subject to very strong adverse selection is not surprisingly non existent. As the lead author of the paper, University of Michigan Stephen Katz told Vox, a hip replacement in the US could cost nearly $100,000 out of pocket plus travel and living expenses. Waiting to get one for free in Canada is easy compared to that, he added. Canadians are happier with their system than we are, and life expectancy and other health indicators are higher. So, and even if a significant number of Canadians come to the United States to get health care, which they don't, every year hundreds of thousands of Americans travel abroad in order to receive medical procedures at a much lower cost, a phenomenon called medical tourism. According to a 2015 report by the U.S. International Trade Commission, between 150,000 and 320,000 Americans travel abroad every year to receive health care. Given the high cost of healthcare in the U.S., Americans cite savings as the most common reason to travel abroad for health treatment. For Americans without health insurance, the difference in cost can be staggering. A United States International Trade Commission study claimed that while uninsured Americans could expect to pay $30,000 for a knee replacement in the United States, they could get the same surgery for $12,000 in India, for example. So there's almost no evidence that a significant number of Canadians come to the United States to get health care, and even if they do, thousands of Americans travel abroad every year to get health care in other countries because the American healthcare system is more expensive. So, yeah, so let me go to the other misleading talking point. All right.
We live sicker and shorter lives.
Of course, but there are many factors outside of our healthcare system which account for this. For example, America leads the developed world in automobile accidents due to the fact that we prefer driving to public transportation, which lowers our lifespan drastically. Yes, as well as...
Okay, so he basically goes on a sort of a lecture. I'm not really going to play the entire lecture about how there are many factors affecting life expectancy, such as obesity rates, cultural factors. He just mentioned transportation plays a role, which can increase automobile accident. And he talks about you can't solely blame the U.S. healthcare system on low life expectancy. And that is, in a sense, it is actually a good point. Life expectancy is extremely complicated. You would have to look at multiple factors. So you can't solely blame low U.S. life expectancy on the U.S. healthcare system. But what you can blame it on is that thousands of Americans die every year because they don't have access to healthcare. In the United States, about 28 to 30 million Americans don't have health insurance or healthcare because they can't afford it. So, and there are multiple studies that show that if you have a healthcare system where millions of people don't have insurance, thousands every year will die because they don't have that insurance. So, when the Republicans tried to pass health care in 2017, The Congressional Budget Office predicted that 23 million fewer people would have health care if the Republican health care bill became law. So Bernie Sanders said, when you throw 23 million people off of health insurance, people with cancer, people with heart disease, people with diabetes, thousands of people will die. There is study after study making this point, and PolitiFact rated it as mostly true. So they came to this conclusion by looking at multiple studies linking not having health care to death. In 2002, a panel of more than a dozen medical specialists convened by the federally chartered Institute of Medicine estimated that 18,000 Americans had died in 2000 because they were uninsured. In January 2008, Stan Dorn, a senior research associate at the Urban Institute, published a paper that sought to update the IOM study with newer data. Replicating the study's methodology, Dorn concluded that the figures should be increased to 22,000. A 2009 American Journal of Public Health study concluded that a lack of health insurance is associated with as many as 44,789 deaths in the United States, more than those caused by kidney disease. Three studies looked at the state-level expansions of Medicaid, and in each case found significant improvements in mortality after such expansions of coverage. These include a 2012 New England Journal of Medicine study of New York, Maine, and Arizona by Harvard researchers, and a 2014 study of Massachusetts by researchers from Harvard and the Urban Institute. A 2014 study published by the blog of the health policy publication Health Affairs looked at states that at the time had declined to expand Medicaid under the Affordable Care Act. So Republican states that didn't want to expand Medicaid after the Affordable Care Act put Medicaid expansion as an option. It estimated that the 25 states studied that didn't do this would have collectively avoided between 7,000 and 17,000 deaths. A 2014 study in the Journal of Clinical Oncology found improved survival rates for young adults with cancer after securing insurance under the Affordable Care Act. A 2017 study in the Journal of Medical Care looked at the provision of the Affordable Care Act that allows young adults to be covered under a parent's policy. The study found a decline in maternal mortality among this population from diseases amenable to preventative treatment. And we found two papers with results that didn't exactly show that not having health insurance leads to increased deaths. So these are the two studies over here. But even the two lead authors of the more equivocal study, so even the two lead authors of the study showing no increase in death, have told us that the scholarly record demonstrates that having health insurance saves lives, and that not having insurance could lead to additional deaths. So it is, in a sense, fair to say that you can't solely blame U.S. healthcare system for low life expectancy, but you can blame the deaths that happen in the U.S. Um, on the fact that that we don't have universal healthcare, and that we have 28 to 30 million people who don't have healthcare. So let's go to further. Okay.
And globally, we're more likely to see newborns die. We're even behind Bosnia.
Flat out untrue. This claim is based on extremely misleading statistics. Yes. In the US, if a baby is born who can be saved but isn't, their death is reported in the neonatal mortality statistics. But in other countries, it's more common for babies in this situation to be counted as miscarriages or stillbirths, and they therefore aren't measured in said country's infant mortality statistics. Also, in the US, very low birth weight infants are considered to be alive. Because, they are. But in places like Canada, Germany, and Australia, a premature baby weighing less than 500 grams is considered to be already dead, even if it's breathing and has a heartbeat. So they don't have to add it to their infant mortality statistics when their healthcare system fails to save its life. Indeed, and interestingly enough, since 2000, of the 52 surviving babies who were born weighing less than 400 grams, 42 of them were born and saved in the US.
But we have freedom.
Okay, so Freedomtoons is right in that there are reporting differences in how different countries measure infant mortality. But if Freedomtoons actually bothered to do any research on the issue, he would know that there are actual research papers that try to account for the differences and try and make a more similar comparison. So this is an article published in the National Bureau of Economic Research. Why is infant mortality higher in the US than in Europe? So, what explains the United States' relatively high infant mortality rate? There are numerous theories as to why the infant mortality rate is higher in the US than in other countries. There may be reporting differences for infants born near the threshold of viability, with the US more likely to count them as live births, while other countries are more likely to count them as miscarriages or stillbirths. And they also did other reasons. Babies in the US might have lower birth weight, uh, predisposing them to worse outcomes. US babies might have a higher neonatal mortality rate or higher post neonatal mortality rate than do babies of similar birth weights and gestational age in other countries. To quantify the importance of these potential sources of US IMR disadvantage, the authors combined natal microdata from the US with similar data from Finland and Austria. These countries provide useful comparison because Finland has one of the lowest infant mortality rates in the world, and Austria has infant mortality rates similar to much of the continental Europe. To address the reporting issues, the authors limit their sample to infants born after 22 weeks above gestation with birth weight over 500 grams, since births are required to be reported among these thresholds. They also limit their analysis to singleton births, as access to reproductive technologies have increased the frequency of multiple births, which have higher mortality rates. So basically, they try and correct for the reporting differences in order to make a fair comparison. And what are the results? So this is the actual study right here. This source here is just a summary. This is the full study. So right here, the U.S. has higher infant mortality rate than peer countries. In this paper, we combine microdata from the U.S. and similar data from 4 European countries to investigate U.S. infant mortality disadvantage. The U.S. disadvantage persists after adjusting for potential differential reporting of births near the threshold of viability. While the importance of birth weight varies across comparison countries, relative to all comparison countries, the US has similar neonatal mortality but higher post neonatal mortality. So, so even after trying to make a similar comparison, which they try and do, there is still a difference in mortality rates in the US. Now, why are there? If you go back to the summary, um, right here. Finally, the authors explore how the United States IMR disadvantages varies by racial and educational group. They find that the U.S. higher post-neonatal mortality rate is driven almost entirely by excess mortality among individuals of lower socioeconomic status. As the authors note, infants born to white college-educated married women in the U.S. have mortality rates that are essentially indistinguishable from similar advantaged demographic in Austria and Finland. The authors conclude these new facts suggest that a sole focus on improving health at birth, for example through expanding access to prenatal care, will be incomplete, and that policies that target less advantaged group in the post-neonatal period may be productive avenues for reducing infant mortality in the U.S. As an example of a potential policy lever, they point to home nurse visiting programs, which have been shown to reduce post-neonatal mortality rates in randomized trials. So, right here, why infant mortality rates are so high in the U.S. This is a research paper from Texas A&M University, and right here. Okay, part of the answer. Sorry, right here. Let me just. Yeah, social programs, benefits of home nurse visits. This is what the researchers provided as a potential way to decrease infant mortality. Social programs in many European countries that provide free home visits from nurses for new parents might help increase protective factors and decrease risky ones. The nurses can give the baby a checkup. But perhaps most importantly, they can provide advice for providing SIDS and can inspect the home for possible hazards. And some of these home nurse visiting programs exist in the United States, though they are not nearly as widespread as they are in other countries. So home nurse visiting programs are free in many European countries. So it turns out that the government investing in their citizens and using taxpayer money could actually decrease the infant mortality rate. And if Freedomtoons had actually bothered to research this issue and actually look at the research papers, he would have found this out. So let's go further to the other talking points. Let's see.
A republic.
So what, besides our economy and military, are we actually number one in?
Not like either of those things are very important.
You can't blame him for being dismissive. The left's been working tirelessly to destroy both.
Turns
Okay, how has the left been tirelessly trying to defeat the military? This claim makes absolutely no sense whatsoever. Again, he doesn't provide any source whatsoever. Some people on the left have argued that the United States needs to decrease its military budget. So, is Freedomtoons considering decreasing the military budget as destroying the military? It's very ironic because Freedomtoons is usually against big government and he's usually against the US government using Americans' taxpayer money in order to fund things. So, why does he not have a problem with the United States spending billions of dollars on the military? So, let's take a look at this. This is from the Peter G. Peterson Foundation, US defense spending compared to other countries. So, the United States in 2017 spent $649 billion on the defense budget. So, to give a sense of how much this is, that's more than China, Saudi Arabia, India, France, Russia, the United Kingdom, and Germany combined. So even if these seven nations combine their military budgets together, they still wouldn't be able to surpass the United States military budget of $649 billion. Of $649 billion. So is Freedomtoons arguing that cutting this budget is the equivalent of destroying the U.S. military? You can still cut this budget and still spend more on the military than almost any other country. To give another example, the Senate in 2017 wanted to increase the military budget from about $620 billion to 700 billion. They wanted to add $80 billion to the current military spending. That increase of 620 billion to 700, that $80 billion increase increase alone is enough to make public colleges tuition free in America. So public colleges to make public colleges in America tuition free, meaning taxpayer funded, that would cost about 80 to 100 billion dollars. The increase alone from 620 billion to 700 billion would be enough to make public colleges tuition free. So it's very weird that Freedomtoons has almost no problem spending more on the military than the next seven countries combined, but yet he has a problem with the United States spending taxpayer money to improve social safety net programs, improve infrastructure programs. So I guess his priorities are mostly on the military and not on policies that can actually help American citizens. So let's go. Okay, let's go to the next talking point. Okay.
a lot of things.
I was waiting for this to turn into a hacky regurgitation of the pompous monologue from the newsroom.
Civilian gun ownership,
Good.
mass shootings.
Incorrect. The claim that the U.S. leads the world in mass shooting frequency or deaths is based on data supplied by Langford, who refused to release the actual list of shootings he gathered for his assessment. Odd.
Yes. Also, Langford's study, which again he won't release the full data on for some reason, reported that over 47 years there were 90 public shooters in the US and 202 in the rest of the world. Yet when looking at data on foreign attacks, for just 1/3 of the amount of time Langford studied, over 1,400 shootings could be found outside of the US. So, something fishy is going on with that data.
All right, so he talks about mass shootings. But as conservatives love to say, and conservatives do say this a lot, and it is true, most gun crime in the United States are not mass shootings. If you look at this BBC article on August 5th, 2019, this was after the recent mass shootings, like right here, mass shootings account for a tiny proportion of all gun deaths. Of the 36,658 who died in 2016, this is in America, there were 22,938 suicides, 14,415 homicides, of which 71 died in mass shootings. So mass shootings only make up a very small percentage of gun crime. So even if uh, the United States has more mass shootings or doesn't have more mass shootings, it doesn't change the fact that most gun crimes are not mass shootings. So let's compare the United States gun homicide and gun suicide rates to other modern industrialized countries that are just about as wealthy as the United States. So this is a PolitiFact article, The Facts on Guns in Six Charts, a 2018 midterm report. So when you compare U.S. gun crime to other countries that are not as wealthy as the United States, such as Trinidad and Tobago, the Bahamas, Brazil, Honduras, Colombia, Guatemala, you can go on and on. The United States has lower violent gun deaths, but this is not exactly a fair comparison because you're not comparing the United States to other similar countries that are just as wealthy as the United States. So these countries have higher gun crime, but it's not. But it could be because of other factors such as higher poverty rates, government corruption, just having an overall poorer country. So when you compare the United States to other high-income countries, such as all of these other countries, Austria, Australia, Belgium, Canada, the Czech Republic, Denmark, Finland, it goes on and on. The United States has higher firearm homicide and suicide rates per adjusted for population in other high income countries. This is for 2010. But it says right here, but if you compare the United States to other advanced industrialized nations, the gun death is far higher. The chart above shows the United States firearm homicide rates is 7 times higher than the closest rival, Canada and Portugal, and its firearm suicide rate is almost twice as high as the next closest country, Finland. So these are all adjusted for population. These show the firearm homicide and suicide rates. So that's the other reason why Freedomtoons doesn't really know what he's talking about, because mass shootings only make up a small percentage of gun deaths. And I guess liberals also need to acknowledge that the mass amount of gun deaths, almost a very few percentage of them come from mass shootings. So let's go to the next talking point. I think this will be the last talking point of the video. I think we've covered enough. So let's go right here. Okay. Okay.
3.
As elections are tampered with, water can't be drunk from taps.
Yes, no one, anywhere, in the entire U.S. can drink from any tap, anywhere, ever again, because in one city of one state, the water supply was compromised. Taps are cancelled, no more water anywhere, for anyone, from taps. Say goodbye to taps. They don't exist anymore.
Not to mention, which political party was in charge of Flint when this happened? The Democrats? Oh, and who's been supplying them with solutions and offering to repair the city's filtration system? Private companies?
Oh, that's gotta hurt.
Okay, so this again proves that Freedomtoons is a complete and absolute moron. His source for this is that the Musk Foundation, from Elon Musk of the Tesla company, uh, honors pledge donates cash to bring clean water to Flint and Michigan schools. So so in this article, Elon Musk decided to donate money in order to make sure that certain parts of Flint, Michigan, had clean water. But what exactly does this prove? Is Freedomtoons trying to say that every time that something happens to public infrastructure, such as roads, bridges, roads, bridges, and other damages to infrastructure, that we should focus or we should hope that voluntary donations from rich people will somehow solve this, or that this is somehow a long-term solution. So if a road gets destroyed or a bridge gets damaged, should we just wait around for a rich guy to voluntarily decide, yeah, I want to donate to this and to donate to fix this? Is there any country that has done this? Is there any country that doesn't have publicly funded infrastructure systems and just waits around for rich people to donate to fix these infrastructure programs? So it's absolutely stupid as a long-term scenario that private individuals voluntarily donating are going to fix the nation's infrastructure programs. Another reason why this point is stupid is because the reason why the situation, the lack of clean water in Flint occurred is, yes, partially due to public officials who did not act appropriately in order to ensure that the citizens of Flint had access to clean water. Um, so you can partially blame the public sector for it. You can also blame the private sector. The reason why you can do that is because uh, the uh, the water in Flint? Why did it have extremely high levels of poisonous materials? It was because the government of Flint wanted to find a cheaper way to get water other than directly going to the water systems of Detroit. It was expensive to get water from Detroit, so they decided to get water directly from the Flint River. Now, why did they do this? It was because the town was on the verge of bankruptcy. Now, why was it on the verge of bankruptcy? So, if you look at this article here, from Libby Nelson. She's a professor of public affairs at American University. The reason why Flint was on the verge of bankruptcy is right here. Flint was once a prosperous manufacturing town, but it never recovered from the closure of General Motors plant, again, private industry, in the late 20th century. By 2013, when the water saga started, Flint's population had dropped from 200,000 in the city's heyday in the 1960s and 1970s to about 99,000 today. Its landscape was dotted with abandoned homes, the unemployment rate was 16%, 42% of residents, including two-thirds of children, were living in poverty, a higher share than even Detroit, which had become a symbol of post-recession urban plight. Flint was going broke. It had lost 75% of its property tax base since the 1980s. In 2011, an emergency manager took control of the town's finances. The city was overloaded with $1.1 billion in unfunded pension costs. So for Freedomtoons to praise private companies shows that he has absolutely no idea what he's talking about. Private companies played a role in devastating Flint because General Motors was literally created in Flint, Michigan, and they decided to close down their plants. So right here, this is a November 22nd, 1997 article from the New York Times. GM to close car factory, delivering big blow to Flint. Faced with dwindling demand for large cars as more Americans switch to sport utility vehicles, minivans and pickup trucks, the General Motors Corporation announced today that it would close its 2,900 employee car factory in Flint, Michigan during the third quarter of 1999. Let's see. Let's see. Flint is situated 60 miles northwest of Detroit, and it rivals in historical importance for the auto industry because GM Motors was literally founded in Flint, Michigan. A sit-down strike in 1937 at another GM factory in Flint, which has since been demolished, led to the GM's recognition of the United Automobile Workers Union. This was the union that represents auto workers in GM. So right here, the UAV's leaders, this is the union, were furious with the latest factory closing, noting that GM is spending billions of dollars to build factories overseas, from Brazil to China, even as it closes factories in the United States. Closing this facility is a betrayal of GM's workforce, of the community, and of the country, especially in light of GM's huge profits, as Stephen P. Jokic, president of the UAV, said. GM earned more than $4.96 billion on sales of $129.28 billion during the first 9 months of this year. The company declined to respond to UAV's criticism. So even though GM was profitable working in Flint, Michigan, they decided to close factories in Flint which devastated Flint, Michigan, and partially caused the economic conditions that led to moving the water sources, which had high lead levels. So, and again, another reason why this is absolutely moronic is because if private companies had nothing to do with the bad water quality of Flint, Michigan, why did the state Michigan Attorney General sue two companies over the Flint water crisis? This is a New York Times article, June 22nd, 2016. Blame for the tainted water in Flint, Michigan has engulfed federal regulators, the governor, state employees, and city officials. On Wednesday, the Michigan Attorney General took sharp aim elsewhere, the private sector. Bill Schuett, the Attorney General, announced a lawsuit against two companies that he said imperiled public health in Flint and contributed to the city's lead-poisoned drinking water. The companies, Veolia North America and Lockwood, Andrews and Newnham, or LAN, were awarded contracts to advise the city about using the Flint River as its drinking water source. But Mr. Schuett said each failed to sound alarms about lead contamination, overlooked obvious problems, and were complicit in the series of events that caused lead to leach from pipes and poison children. They failed miserably in their job, Mr. Schuett, a Republican, said at a news conference in Flint. Basically botched it. Didn't stop the water in Flint from being poisoned, they made it worse. That's what they did. So if the name Veolia is familiar to the people in Massachusetts, Veolia had to pay $1.6 million for massive sewage spills, discharges causing shellfish bed closures in Plymouth Harbor. This is the same company that had to do that was in Flint, Michigan. They had to pay $1.6 million to the state of Massachusetts for violating its environmental laws. So right here, this is an Intercept article. Ironically, Veolia titled cost savings in Pittsburgh when it made uh, its pitch in January 2015 to work on Flint's water. In February that year, the company began $40,000 contract to study the city's water quality issues. Veolia proposed having greater control, which the company projected would come with considerable savings as it had in Pittsburgh. Um, let's see it right here. Okay. But when Veolia began work on its contract in Flint, it didn't tackle the lead crisis that was already well underway. Instead, in an interim report, Veolia presented to the Flint City Council Public Works Committee, the company that builds itself as the world's leader of environmental solutions, that Flint's water was safe, dismissing concerns that had bubbled up around Flint and failing to even mention lead. Though Flint residents had been holding up containers of brown water at public meetings, the company assured the committee that Flint always had some discolored water. Doesn't mean that the water is unsafe, the report said. Veolia also suggested that if there were problems, they might reside with particularly vulnerable individuals. Some people may be sensitive to any water, offered the report. So, right here. So, in an email to Intercept, Veolia spokesperson Kristen Blake emphasized that the lead issues were excluded from the company's work in Flint. So the company is arguing that it wasn't our job to look at the lead levels in Flint. So it's not our fault that we didn't notice high lead levels in Flint, Michigan. Uh, it says right here at so here. Okay, at Flint's direction, Veolia's analysis was focused on levels of disinfection, byproducts, discoloration, and taste and odor issues. So, she wrote, yet, as the Michigan's Attorney General suit pointed out, according to Veolia's 2015 interim report, the only issue that Veolia's that was not in Veolia's scope of study, meaning the only thing that Veolia did not have to study, was why they changed from Lake Huron water via the Detroit system pipeline or the history of the utility. So Veolia again claims that it wasn't their job to study the lead levels in the water, but as the Michigan State Attorney General points out, according to Veolia's own report, they did have to study lead levels in water. The only thing they didn't have to study was why they changed the water levels from Lake Huron via the Detroit system pipeline, or the history of the pipes, the history of the utility. So again, the idea that private companies had nothing to do with the crisis in Flint is nonsensical. So almost every one of Freedomtoons' talking points has really been debunked, and Freedomtoons has proven that he hasn't really done any research into these issues and has basically just relied on talking points by conservatives, libertarians, Republicans that are not really based in research.